Welcome to today's Your Weekly Medical Town Hall. Sorry that I missed you last week here at Thapa 2, the center of the aerospace testing universe. For those that are tuning in for the very first time, I am Gwendolyn Foster, your medical group commander. And with me today, I have Captain Lankert, our public health officer, Major Bates, our bioengineering flight commander, and Lieutenant Vallows, our TRICARE operations flight commander. Our moderator for today to get after your questions is Tech Sergeant Tercios Munoz. And as you know, that number that is flashing at the bottom of your screen, please use that so we can get to your questions after we finish with this new update. With that, I'm going to turn it over to Captain Lankert, who's going to tell you about the current situation. Captain Lankert.
Awesome. Good afternoon, everybody. Thank you for tuning in. As always, if we have the slides be put up real fast. So this is going to be your overview of the United States right now. So we added a little bit of a different chart in the bottom left-hand corner since there's been a lot of talk in the news about which states are seeing improvement, which aren't. This is a nice little handy-dandy color-coded chart, which basically once you start getting a little orange, that means the states are increasing in their cases for the new daily cases. This is a good way to monitor trends. As you can see, California is still increasing. A lot of actually the West Coast is. There's your top numbers in the top left-hand corner. We're over 100,000 in deaths. We've added 146,000 cases since the last time we met last week. Bottom right-hand corner is the same symptoms we show every week, just to be kind of aware of COVID symptoms, which range from anywhere from a slight cough to a full-blown fever, shortness of breath, all that good stuff. As far as your updates go, so there's an additional LA County Health Directive that's actually coming out today. It's going to be dated for tomorrow, which is going to allow some gyms, arenas without live audiences, day camps, hotels, and a couple other areas to start reopening with modified guidance. So they're still going to have to follow the same social distancing, all this other good stuff, and get approval to open. But the state is starting to open up those areas. Just FYSA, so for your situational awareness, there are 125 global vaccines in development currently. So the world's kind of operating a very quick clip in order to get those vaccines kind of pushed through all the approval processes, et cetera. The United States has a bunch in the pot as well, so that's still pushing. No news as far as actual progression yet, though. So still practice those good social distancing measures in the meantime and prevent yourself from getting sick. More importantly, actually, and more pressing, I suppose, that cases right now, you can see in the bottom left-hand corner, they are rising in 21 states. Just as those reopening plans are beginning. A lot of these have been attributed to pre-pandemic behavior being seen in many of them. So the states opens up, and rather than people practicing those behaviors we harp on every week, they're kind of going back to, well, now we're all back to normal. So just want to reemphasize that it's completely up to the individual. Just because you see things opening up, just because you see different things in the news, anywhere basically, make sure you do that research for yourself. You listen to those good sources, and you continue to practice the social distancing behaviors and wear your mask, wash your hands. Try to just keep yourself safe, regardless of what's happening around you. Make sure you take that initiative to do your own research, listen to our town halls, go to the CDC website, the WHO website, all these really reputable sources, and still just, again, it's really going to be individual as far as keeping yourself safe. LA County has also been urging protest attendees, so if that includes anybody listening here, to self-monitor if you go there, because the event is kind of outside of a contact tracing system. They don't know your name. They don't know who you've come in contact with. You don't know who you've come in contact with. So please make sure if you are participating in those events, you self-monitor yourself for any symptoms, and then obviously call your doctor if you do start seeing any. So next slide for that. This is going to be your local picture. Again, top left corner is our 7-day running average. You can see we've basically stayed pretty stable. So not necessarily going super down, not necessarily going super high. There's really not a lot of change, which shows that COVID is still very, very present right outside our gates because that is our immediate community. You can see the changes in the bottom left-hand corner. That's from last week. And then in the right side, again, California is going to that stage 2 reopening. We have not yet been approved for the DOD travel restrictions to come off. But the state is trying to open up more of those resources. You'll see that on base as well, where a lot of FSS's organizations have started to open to modified operations that still make sure that the base population stays safe. But that's all I have for this week, pending any other comments, Colonel Foster.
Thank you, Captain Lankert. Next slide. As you know, this is the slide we show every week, and as you can see, we're starting to get a little bit more green as we work to getting back to that return to full capacity. Even though we are still in HPCon Charlie, we are looking for those innovative ways to make sure you're getting the care that you need, whether that is virtual or face-to-face. And we continue to work very closely with our healthcare community partners to make sure they have the medical capacity that is needed outside our gates. And with that, now I'm going to turn it over to Major Bates for a bio update. Next slide.
Thank you, Colonel Foster. Good afternoon, everyone. And I wanted to spend a few minutes today talking about mask wear and the wing policy. I know a question came up last week, so I definitely want to answer any questions that do come up, so we can go to the next slide. So this slide basically just tells that mask wear obviously is mandatory per the wing commander. If you wear a respirator for your job, then that will replace your mask wear requirement until that task is up, and then you're required to go back to mask wear. Now, there are going to be certain situations where maybe mask wear is questionable, where maybe I can't do it for my job. And so that's why we have consulting offices like bioenvironmental engineering, my office, public health, Captain Lanker's office, and other organizations that can help commanders make educated decisions on if we can't get there, but we still have to get this part of the mission done, then here's some other options that we can do. And so basically, that's what this slide here is saying. If you have any questions at all, definitely don't hesitate to contact our office. And the number is below 277-3272.
Thank you, Major Bates. Next slide. Now turning it over to Lieutenant Vowles for a Thapa update.
Hello, everyone. So what you see here on the screen is the HealthNet Federal Services, or in other words, TRICARE phone number. And if you haven't done so already, please, we highly recommend you save this phone number in your cell phone or write it down to make sure you have it readily available. COVID or non-COVID, it is a tremendous resource for all of our patients and TRICARE beneficiaries. So first off, I'm just going to touch on 2 resources for that phone number that we are currently using right now in this COVID times, and that is for enrollments and also referrals. So for enrollments, right now we've had to postpone our face-to-face weekly medical in-processing for patient safety concerns and COVID concerns. So we have asked the patients and beneficiaries that if you are new and PCSing to Edwards Air Force Base and you're looking or anticipating to have medical care, please enroll to the 412th Medical Group. And how you can do that is by calling HealthNet or TRICARE at that phone number previously shown, and just let them know that you're new here, and they'll get you enrolled within 10 to 25 minutes, depending on how big your family is. Just make sure the sponsor's calling and they have all the social security numbers of the family members readily available to provide to HealthNet. The other most important part for this phone number, during COVID or not during COVID, is going to be referrals. So this is a lifeline for patients when it comes to referrals. I've used it personally on my own referrals, but if you have a question on whether or not your referral is ready to be used, whether or not your referral is expired, who you're being referred to off-base for your specialty care, or even if you want to change your off-base provider to someone else, that is the phone number that will be able to get it done. HealthNet is the only foundation that can essentially make those types of changes and offer you that type of information. So that's it for that phone number. It is very important. Please save it and please utilize it. They have tons of resources for our TRICARE beneficiaries by just giving them a phone call or by going to their website, tricare-west.com. Lastly, I'm just going to cover some of the new services that the Patient Administration Flight is going to begin offering starting next week, and that is to include records copy request, health benefits advising, specifically claims and possibly collections, and then lastly, virtual out-processing health benefits briefings. So the catch on this is, yes, we're open for those services, but it will be by appointment only. I will be sure to get our customer service phone number out to as many places as possible. But if you have a pen now, it is 661-275-2668. That is the patient administration customer service phone line that you can call to book your appointment. We're going to make sure that the foot traffic is monitored so that no patients are crossing each other's paths. That way we're keeping our patients, our facilities, and our staff safe through our HPCon Charlie levels. And lastly, also check out the medical group Facebook page for more information on what I just discussed today and other information on your HIPAA rights and other medical group information as well. And that's all.
Thank you, Lieutenant Vallows. Next slide. And always, we couldn't do this without you, so continue to do those safe practices. If you can't keep that safe physical distance of 6 feet, to use your cloth mask, wash your hands, as you heard Captain Lankert say, and cover your cough. And as always, if you think you have been exposed to COVID or have COVID symptoms, please do not hesitate to call your medical group. And with that, now I'm going to turn it over to Tech Sergeant TM to get to your questions. Tech Sergeant TM.
Okay, first question. Now that school is out, kids are constantly at my door asking for mine to come outside. Is it safe? What precautions should outdoor play include?
Captain Lankert.
Excellent question. So yeah, as the situation changes, there's going to be a lot more people doing outside stuff. The kids especially is going to be kind of a trickier thing because you're going to have to basically communicate with them to explain the same things that we've been saying to the whole patient population, to everybody on Edwards essentially. So if kids do want to play together, that's absolutely fine. You still want to work on minimizing that risk. And the main risk is going to come from close contact with other kids, with other people. So if they want to play together, the ways that you could really minimize that is to make sure to tell your kids or kind of set those ground rules of, hey, don't get too close to the other kids. So doing sports or something like that requires like separation, or even playing together, just separate it out. Keep that distance. If your kids are old enough, having them follow the same base policy with the mask wear. But again, it's really going to be just harping on if they do go out to play with other kids, make sure they're not playing really close together, like no contact sports, ideally. Make sure they're following up on that good hygiene measures. Make sure your kids aren't playing with other kids when they're sick. That's kind of good practice in general. But basically, you're going to apply the same standards that you do for all of us, for adults and for the workplace and such, to children if you do feel comfortable having them go outside and play with other kids. Because the risk really is small as long as they're socially distanced. Now, if you don't think your kids are going to be able to maintain that, that's kind of where you're going to get a little larger of a risk. So if they're not old enough to necessarily understand, like, hey, you really need to stay like X distance away from your friends, or maybe play this game instead. Like you can play video games with your friends if you don't want to play outside. Just it's going to be over the internet, obviously. But outside it has a lot smaller of a risk because you're not in an enclosed area, all that good stuff. But again, they just need to stay separated and really, really minimize that contact. So there is a way to do it safely, and obviously don't do it with a group of like 20 other kids. So we still want to practice the fewer participants as possible. Awesome. The larger the distance between them. Awesome. And then wearing that mask if it's appropriate and they're not able to maintain that distance for whatever reason. A lot of it is going to be put on the parents to kind of make that good judgment call to say, all right, well, what do I feel is safe for my kids? But if you follow those really, really good key steps of the social distance, at least the physical distance rather, and then just making sure people wash up before or after play, no touching of the faces and stuff like that, they'll be pretty much good to go. That's my biggest recommendation.
And next question. Is mask wear mandatory even if you're walking on the track or trails by yourself on base?
Awesome, yeah. So per base policy, mask wear is mainly required for if you're within that 6 feet of somebody else, like in the workplace, or if you're going to the commissary where you can't maintain that distance necessarily. So if you're out by yourself, you don't have to do it because there's no one else around you. It's just you and the earth or the track or whatever you're doing. So no, you don't have to, even off base, you don't necessarily have to wear a mask just if you're out on your own doing your own thing in nature or running and stuff. It's actually probably a little bit safer to not wear a mask while you're doing cardio by yourself anyways, because we don't want anybody to fall out because they can't breathe too well. But yeah, so if you're out on your own, just exploring, bike riding, doing any stuff like that with yourself or your family that you're normally exposing yourself to, that's absolutely fine. You shouldn't have to wear a mask for that. It's more so when you can't maintain that distancing with other people. So again, commissary, BX, workplace, if you work really close to people, that type of situation.
And so to pile on to that, that means that you have to have your mask with you.
Yep.
You should have your mask with you at all times, because you never know when someone is going to come and become in your bubble. So you want to show that you are a good, safe person by putting that mask on, so that way you are protecting them. Mm-hmm. All right. Thank you.
Next question. Smallpox vaccinations, are they being waived for members PCSing because of the unknown interactions with COVID?
We will take that question back and actually get some of the experts to weigh in on that, so we don't want to give misinformation. And so we will get that answer, and we'll make sure to have that on our Facebook page, as well as we'll discuss that at our next town hall.
And waiting to see if any more questions come in. Okay. Colonel Foster, I'll leave it to you.
All right, you see I'm looking at my watch because I know we still have some time. She turned it over to me pretty quickly there. So again, if you have those questions, we are here for you. So we want to get to those questions that you may have. So as you heard Lieutenant Vallis say, we are really trying to get and open up some of those services that have right now either been paused or really in that virtual realm, to see how we can find that sweet spot as far as virtual with some face-to-face. And as you heard Major Bates talk about that mask wear, we want to make sure that every area is safe as we're getting back into that return to full capacity. So as more folks are coming back to work, if it is required, we want to make sure that all those areas are safe. So bio is out assessing, public health is out assessing. So if you have any questions like that, we are here for you. And I see Sergeant TM raising her hand, so I think we have a question.
Okay, if I drive somewhere or stateside, for an example, Iowa, where no DOD COVID restrictions are applied, when I return to California, is a 14-day quarantine required or optional at the moment?
All right, so recently our Wing Commander, General Higer, did put out a policy. So as far as a 14-day quarantine based on travel, that is no longer. So that has been rescinded. So if you are traveling, then a quarantine is not required. So perfect example is with our folks that are PCSing here to Edwards. When they arrive, they are not required to quarantine. Now, with that being said, those that are arriving, depending on where you're working, what's going on, and how you traveled here, the commanders do have that discretion to be more restrictive if it warrants it, because again, we want to make sure that we keep you safe and that we keep those around you safe.
Okay. Still waiting to see if we get any more questions.
All right. So while we're waiting for questions, Major Bates, as you've gone out and done assessments, what have you seen as far as those best practices, as far as behaviors out there?
Yes, ma'am. So during our assessments, we found out that for the most part across the base, people are doing a really good job with mask wear. People are coming up with innovative ways to make that policy work. Every shop is going to be a little bit different, so I definitely leave it to the experts in those shops to be able to figure out a way that works best for them, specific to their shop and their area. We have assessed a pretty good portion, a representative sample for pretty much all of the groups on the base, and so I know our team is confident that everyone out there is making the best of COVID-19 and trying to get things, keep the mission going, and for the most part, it seems like they're doing a really good job. So definitely kudos to the Edwards team.
Thank you, Major Bates.
And no other questions right now, ma'am.
All right, so Captain Linker, what have you seen as far as your assessments? I know with it being summer and a lot of gatherings are going on as far as events, what are you seeing from that public health eye?
So from the public health eye, we've seen similar things to what Major Bates has been seeing. So we've been seeing a lot of best practices. Ironically, a lot of the stuff we've been seeing has been people that have gone actually above and beyond and done a lot of stuff that isn't necessary. I mean, it's awesome. It adds to it, but it's definitely going like super far beyond what's actually required to really manage situations with the virus, which is awesome, which is cool. We love the innovation culture here at Edwards. A lot of stuff with the gatherings. Unfortunately, because COVID is such. I mean, A, it's a new disease. B, it's a disease. So a lot of the stuff we recommend is super subjective, just because you can't really put a number on like, it will be safe. If you do this, you will for sure be safe. Because there's no way we can give guarantees. And I know sometimes that's kind of the more frustrating part of public health is we can never say you will not get this if, or you will for sure get this here. All we can really do is communicate and risk. So the base itself, all the organizations we've been working with have been very, very open to discussing risk, to be discussing, hey, what are we really looking at here? And they've been super informed, which has been really a testament to how well people are really internalizing this message. So unfortunately, we run into a lot of situations where we want to give that exact, 40 people are perfect for this exact space, but thankfully, the base has really been working with, what's the actual risk here if we do this many people or this type of setup? And we've seen a lot of, just like how Major Bates said, a lot of innovation when it comes to wanting to host these new events and doing so in a safe way. So we've been seeing a lot of good stuff. It's been really cool.
Excellent.
So along those lines, what should I do if I'm going to the pool? What precautions should I take?
If you're going to the pool, so pools are fun. Pools are similar to kind of other fitness type activities. So I know it depends on what the pool's policy is. So if you're talking about Edwards, if you're talking about off-site places, ideally the pool will be spaced out so that people have a lot of distance between them. Ideally there won't be a lot of people around you because of the policy of different policies that are in place. So we're still trying to do that. Minimal people means minimal chances for disease transmission or anything of that nature. So for pools, since usually you go to the pool to swim, to exercise, you're going to be respirating a lot more. Same thing if you're doing cardio, if you're running around, that good stuff. So ideally to keep yourself safe, make sure when you're outside the pool, you're wearing your mask, you're doing your PPE. If you decide to go to a pool, say off base, and there's a bunch of people there, I would personally advise against it because there's going to be people exercising, they're going to be breathing a lot more. As a reminder, it's not going to be the pool water that you're worried about or any type of that nature. It's going to be literally you're being around other people who are breathing because that's the primary way that the virus transmits. So if you do choose to go to a pool, make sure you still stay away from people. Make sure you wipe down any pool toys. I know with talking the base to the base facilities, that's one big key is to make sure we wipe down everything that's common use, all that good stuff. Limit the amount of people that are going into the facility, people there, and then just keep that distance really. So as long as the pool is set up and they're following the state guidelines as well, it should be a relatively minor risk. But again, make sure you're wearing that mask when you're outside. Make sure you're minimizing that interaction with other people and just kind of sticking to your family unit. Those would be my biggest recommendations. Again, it's gonna vary on what situation you're basically walking into. And what their own policies are for that specific pool that we're talking about.
So question to follow that, is it safe to go into the water?
Yeah, so the pool water isn't going to be a major source of transmission. It is very chlorinated. It would require, I don't want to go into hypotheticals, but yeah, the pool water isn't really the main thing that we're worried about. What we're more so worried about is, again, the people breathing. So it's being around other people they're basically off-gassing, if someone's infectious, the virus into the air. So it's the same thing as if you're walking around other people, like in the grocery store, and they're not wearing masks or something and they're sick. Same thing with flu, same thing with all the other respiratory diseases. It's basically going to be the people that are basically spreading it through talking that we're going to be more concerned about for a pool situation, less so than you getting exposed to like a tremendous amount in the water or something like that. It's definitely going to come more so from the people themselves, and that's why we focus on the whole limiting your space or increasing your space from other people, making sure there's not a lot of people around you. The same rules outside of water basically apply in the water. The water itself doesn't really change that dynamic too much.
That's great.
Alrighty, well, thank you, Sergeant TM. And so first, I want to thank you again for tuning in Your med group stands ready to continue to help keep you safe and to keep you healthy. And second, during these tumultuous and unprecedented times, the Air Force is out front, and we are leading with our heart from the very top with General Goldfein, our Chief of Staff of the Air Force, and Chief Master Sergeant Wright, our Chief Master Sergeant of the Air Force. They have set the tone, which is truly a hallmark in leadership, and that's all the way from the top all the way to your leadership here at Edwards Air Force Base. General Goldfein says it best that we will not shy away from this. We will take ownership of our part in this, and we will confront it head on. And your med group will do no less. We are in this together, and we stand ready to support. And again, I thank you, and I am proud and humbled to be your medical group commander. We'll see you next week.